Today I'm going to be demoing our agentic caregiver, Avery, as she walks me through a diabetic education session.
Hi, may I speak with Alex Parker?
This is Alec.
Thank you, Alec. Just to make sure I have the right person, could you please confirm your date of birth for me?
Yes, it's April 1st.
Thank you, Alec. And just to be thorough, could you share the year as well?
Oh, I'm sorry. It's 1980.
Perfect. Thank you for confirming that, Alec. My name is Avery, and I'm a diabetes nurse educator here to support you. I know managing diabetes can feel like a lot sometimes. How are you feeling about your diabetes today?
It's still pretty new. I just went to the doctor last week and got a whole bunch of paperwork that I've been trying to shift through. I'm hoping maybe you can help walk me through some of the things I should be doing or paying attention to.
Absolutely, Alec. It's totally normal to feel a bit overwhelmed at first. There's a lot of information, and you're not alone in feeling that way. I'm here to help break things down into simple steps. Today, we'll focus on something called risk reduction. That means learning how to protect important parts of your body.
Avery, what do you mean by risk? Am I at risk for something?
Great question, Alec. When I say risk, I mean the chances of developing complications from diabetes over time. Things like problems with your eyes, feet, kidneys, heart, or getting sick more easily. The good news is there are steps you can take to lower those risks. Today, I'll walk you through what to watch for and how to protect yourself. Does that sound okay? And is there any area you're most worried about right now?
I'm a little concerned about eyes since you mentioned that. I didn't know that was tied to diabetes, and I've been having blurry vision the last few weeks. Is that related to this or anything I should be doing?
Thank you for sharing that, Alec. Blurry vision can definitely be related to diabetes, especially if your blood sugar levels are changing. High blood sugar can cause the lens in your eye to swell, which affects your vision. Sometimes it's temporary, but it's important to pay attention. One key step is getting a yearly dilated eye exam with an eye doctor. This helps catch any changes early, even before you notice symptoms. Have you had an eye exam recently, or would you like help scheduling one? And just to check, can you tell me in your own words why eye exams are important for people with diabetes?
Let's start with I haven't had an eye exam for like 5 years. It sounds like it's something I really should be paying attention to. Can you help me with getting a list of eye doctors in my area in Gilbert, Arizona?
Absolutely, Alec. I can help you find eye doctors in Gilbert, Arizona, and get you set up for an appointment. Regular eye exams are important because they can catch problems early, even before you notice changes in your vision. Just to make sure we're on the same page, can you tell me what you'd expect to happen during a yearly eye exam for diabetes?
I think they would examine my eyes and see if there's any changes or anything to concern about, but I'm not quite sure all the specifics you mentioned.
That's a great start, Alec. During a yearly eye exam for diabetes, the eye doctor will use special drops to dilate your pupils. This lets them look at the back of your eye for any signs of damage, like swelling or bleeding. They're checking for things called diabetic retinopathy and other changes that can happen with diabetes. It's quick and usually painless, and it's one of the best ways to protect your vision. Would you like me to send you a list of local eye doctors and help you schedule an appointment? Next, let's talk about your feet.
Yeah, if you can text me, Avery, the list of the doctors, that would be great.
Of course, Alec. I'll pull together a list of eye doctors in Gilbert, Arizona, and send it to you after our session. I can also help you with scheduling if you'd like. Let's move on to your feet for a moment. People with diabetes need to check their feet every day for cuts, blisters, or changes. This helps catch problems early and prevent infections. Can you walk me through how you might check your feet at home? If you're not sure, I can guide you through it.
I haven't really been paying much attention to my feet. Do you have any suggestions of how I might do something around that or what I should be paying attention for?
Absolutely, Alec. That's a really common question, and I'm glad you asked. Here's a simple way to check your feet each day. Look at the tops, bottoms, and between your toes for any cuts, blisters, redness, or swelling. If it's hard to see the bottoms, you can use a mirror or ask someone to help. Wash your feet daily, dry them well, especially between the toes, and moisturize but not between the toes. Always check for changes and let your care team know if you see anything unusual. Would you like to try a quick foot check together now, or do you have any questions about what to look for?
I'm getting ready to go out the door, so I have my shoes and socks on, but I'm thinking maybe when I'm getting dressed in the morning, that would be a good time before I put my shoes on to look at my feet.
That's a fantastic idea, Alec. Checking your feet in the morning before you put on your socks and shoes is a great habit. It only takes a minute, and it can really help catch any problems early. Just to make sure it's clear, Can you tell me one thing you'll look for when you check your feet tomorrow morning?
I think you mentioned blisters or cuts.
Exactly, Alec. Blisters and cuts are important to watch for. If you spot anything like that or
Hey,
redness or
Avery,
swelling,
I don't want to be rude, but I've got to get going to the grocery store. Can you give me a call back later on this evening? I'm usually free like around 8 o'clock at night. Is that a good time for you to call me?
no worries at all, Alec. I totally understand. I'll make a note to reach out around 8 o'clock tonight. Before you go, just a quick recap. You'll check your feet for blisters or cuts tomorrow morning, and I'll send you a list of eye doctors in Gilbert. Is there anything else you'd like me to help with before you head out? And just to confirm, is 8 p.m. your local time in Arizona?
Yes, 8 p.m. local time. Thanks, Avery. We'll talk to you later. Bye.
Thank you, Alec. I'll call you at 8 p.m. Arizona time. You're doing a great job taking these first steps. If you need anything before then, just let me know. Have a good trip to the store, and we'll talk soon.